What if I told you your knee arthritis may not actually be the real problem? And the shocking part is, many adults over 50 spend years treating the pain, while the true cause keeps getting worse underneath. They take tablets, get injections, use creams, rest more. But the knee still hurts climbing stairs, still feels stiff in the morning, still aches after walking. Why? Because most people are treating the symptom, not the overload destroying the knee. And once you understand this hidden cause, knee arthritis suddenly starts making much more sense. Most adults are told something simple: you have arthritis. And immediately they imagine something permanently wrong inside the knee, something attacking the joint, something impossible to control. But here's what most people over 50 don't realize. In many cases, knee arthritis is mainly wear and tear caused by overload over time. That overload is the secret. The knee cartilage slowly wears down because the joint has been handling more pressure than it can tolerate for years. And this mistake is more dangerous than people think, because many people focus only on reducing pain, but they never reduce the pressure causing the damage in the first place. It's like having a headache caused by a bad tooth. You can keep taking headache medicine every day, but if you never treat the tooth problem, the headache keeps returning. That is exactly what happens with many cases of knee arthritis. The pain is often the warning sign. The overload is the real issue, and the overload can come from many hidden causes: extra body weight, weak muscles, years of heavy work, too much stair climbing, standing for long hours, poor walking habits. Now, here's something shocking. For every extra pound of body weight, the knees may feel several pounds of extra pressure during walking. That means even small weight gain can dramatically increase stress on the knee joint over time. Most people don't know this. They think arthritis pain appeared suddenly, but often the overload has been building quietly for years, little by little, step by step. This is where things get dangerous, because once knee pain starts, many adults move less, and moving less often leads to more weight gain, weaker muscles, and even more pressure on the knees. It becomes a painful cycle. Now here's the good news. You do not need extreme weight loss to help your knees. Even small changes matter. Losing just a few pounds can reduce stress on the joint significantly, and many adults say their knees feel lighter and less painful even after modest weight loss. The goal is not perfection. The goal is reducing overload. And here's what most people over 50 don't realize. Strong muscles protect the knee. Weak muscles overload it. Your thigh muscles, hips, and glutes act like shock absorbers. When they weaken, the knee joint takes more force directly, and this mistake is more dangerous than people think, because many adults stop moving when the pain starts. That causes even more weakness. Then the knee becomes even more overloaded. One major warning sign: difficulty getting up from a chair without using your hands. That often signals weakness in the muscles supporting the knees. Now the shocking part is, simple strengthening exercises like straight leg raises and quadriceps sets will reduce knee pain more than people expect, not because they cure arthritis, but because they reduce overload. And when overload decreases, pain often improves. These are not intense workouts. They are gentle, strengthening movements. And consistency matters more than intensity. Here's something doctors often don't explain clearly enough. Your daily habits matter just as much as your treatment. How you walk, how long you stand, how you climb stairs, how often you sit. All of this affects knee overload. The shocking part is, some people irritate their knees every single day without realizing it. For example, repeated deep squatting, constant kneeling, carrying heavy loads, walking with poor posture, or wearing worn-out shoes. And many adults ignore this warning sign. Pain that increases later in the day after activity. That often signals the knee is being overloaded repeatedly. Now, this does not mean you should stop moving. Movement is important. Walking is important. Gentle activity helps circulation, muscle strength, and joint health. But smarter movement matters, not constant overload. Sometimes, simple activity changes help a lot. Taking breaks, using handrails on stairs, avoiding unnecessary kneeling, using supportive shoes, pacing activities instead of pushing through pain. Small adjustments can reduce stress on the knee dramatically over time. Now, let's be clear. Pain medications and injections can help some people. They may reduce inflammation. They may reduce pain temporarily. And sometimes they are necessary. But here's what most people over 50 don't realize. Pain relief alone does not remove the overload causing the problem. It's like covering the warning light on a car dashboard while the engine problem continues underneath. And this mistake is very dangerous because some people feel temporary relief and go right back to the same habits, damaging the knee, same overload, same weakness, same stress. Then the pain returns again. This is why long-term improvement usually requires addressing the real cause, reducing overload, strengthening support muscles, improving movement habits, managing body weight, protecting the joint instead of constantly irritating it. That's the real strategy many people never hear about. The truth is, knee arthritis is not just about bad knees. It is the result of years of overload on the joint. And once you understand that, everything changes. Because now you can start reducing the real problem, little by little, step by step. You do not need perfect knees to improve your life. You need smarter habits, stronger support muscles, better movement, and less overload. So starting today, ask yourself this simple question: what is overloading my knees? Because when you start treating the cause instead of only chasing the pain, that is when real improvement often begins. If you've been struggling with knee pain or arthritis, share your experience in the comments below.